Hi, my name is Jason. I'm 43 years old. About 4 months ago I was diagnosed with a skin cancer, squamous cell carcinoma, in my throat. It had metastasized into a lump over here, so stage 4. This was caused by the HPV virus. I had no history of cancer in my family and no tobacco use my entire life. So it's quite the shock, of course. I am through treatment right now, which was 33 radiation treatments over the course of 7 weeks and 2 megadoses of cisplatin chemotherapy. So the reason for this video is to tell you guys things I wish doctors and nurses had told me prior to my treatments. So if you are unfortunate like I was and have been diagnosed with throat cancer and you're about to go through this, here's a few little things that I wish I would have known. Okay? Number 1, get the metal fillings replaced in your mouth prior to radiation. Do it now. The reason is because these metal fillings, when the radiation hits them, it does something, I don't know exactly what, but it will make sores in your mouth. Okay, 4 months later, I still have a huge canker sore on my tongue that has prevented me from eating things. Even though my throat has healed a lot and I can start swallowing again, I can't eat a lot of stuff because of that thing, and it's because of that metal filling. Get your metal fillings replaced. I know it's a pain if you got a bunch of them. Do it. It's going to save you. So please do that. Number 1, I wish that had been done. Number 2, you're going to get a PICC line, P-I-C-C. This guy right here that goes into your arm. You may know about these or not, so they can get fluids into you. Okay. The couple of things with this are shave your arm. Okay. You know what arm it's going to go in? Shave your entire arm from here all the way around. The reason is because dealing with this tape and the hair on your arm over and over and over again is a nightmare. The pain of that becomes a lot, difficult. The other thing is you can't shave once they've put it in. So you learn this after the fact. So shave your arm first, then you won't have to deal with that. The next thing is practice wrapping your arm for when you take a shower. You can't get this wet. Okay, so you got to take a shower. So they'll give you all kind of advice on how to do it. Practice it first. This is how I do it. Saran wrap. And it's easier to do it now before you get the PICC line because it won't hurt. When you first get the PICC line in, you'll be all sensitive and it'll hurt and all this, and you'll have other stresses. So if you do it now, okay, pull out a bunch here. Wrap it around your arm. And start going around. See, I can do it now. That was my mistake. See, even I've done it a million times. On the back, wrap around the front like that till it's kind of tight. Now you can go around a couple times. That's the end. But rip that thing off. And then I use rubber bands. Wrap that dude right there, one side of the PICC. Up your arm. Wrap that dude on the other side. And there. You're sealed really good against showering. You won't be able to get in the tub and soak because it will soak past that. A good way to test and see if this is tight enough and working for you is take like a piece of toilet paper and wrap around it first and then wrap this. Take your shower, take it off. Is the toilet paper wet? It's getting wet. Okay. So, but practice that first. It's going to save you big time. The next thing, find out if you're allergic to chlorhexidine. Chlorhexidine is what they use to clean, like clean this area on your arm. So it looks like just little alcohol wipes. I found out I was allergic to it. How? After they'd already done this and put this on, I broke out into a rash that turned into a week-long nightmare of not sleeping, laying like this, scratching. Keep in mind, this is on top of your radiation treatments, your chemo treatments. You can't eat anything. All that, now add on a nightmare of a rash. So find out if you're allergic. It's really easy to do. Go into your cancer center and ask them, you know, the little clean wipe things, get one. What they did on me is took some, cleaned an area on my arm, and then stick one of the tegaderms on it. The tegaderm is the plastic cover that they put on these PICC lines, and just stick it right on, like here, on just a area easy to get to, and let it sit there for a day or whatever, and see, do you start to itch? It's just a little bit of itching or whatever. You can take it off, clean it, you don't have to worry about it. They did that test on me after this broke out, and we figured that was the problem. But to make sure, it did a test. It was on there for like 6 hours, okay, before it started itching, so I took it off. That rash is still there, and that was probably 3 months ago. Okay, and that's probably because my body's weak and not healing real well. But if you find out if you're allergic to that first, then they'll just use iodine, and you'll be fine. Again, you will avoid a huge nightmare. So it may not seem like much, and I'm one of those people that's not allergic to hardly anything. I'm not allergic to stuff. That stuff I am. So figure that out. What next? Practice this. Get an electric toothbrush if you don't already. Your mouth is going to become an absolute war zone. Okay, my gums are still completely messed up and sensitive. Okay, so flossing becomes horrible and you'll gag. But brushing your teeth, you're not going to be able to open your mouth wide and just start going at it with your toothbrush. But you want to keep your mouth clean even if you're not eating. So an electric toothbrush may save me big time to be able to just sneak that thing in there, do your cleaning, spit without a lot of movement and gagging and stuff like that. So if you don't have one, I would do that. Hydration, stay hydrated, big time. I can't stress it enough. Even now, after my treatments, it's very difficult to drink enough water. They also use your PICC line to get hydration in there. Take advantage of that. Get that in there. It's going to help you out. Lastly, this will help with your family. This is one of the first things I did, is get a Facebook page specifically for your cancer. I named mine a group, Facebook group. Okay, so aside from your personal page, just called Jason's Cancer Corner. I invited every one of my friends to it, and that way I update them all, and I can keep my cancer life separate from my normal life. That will become important, because right now your whole world is going to be cancer, but there's going to be times when you want to separate it and just deal with whatever, fun stuff, whatever. So keep that separate, and in that page now you can update everybody you know and say, hey, here's the latest. I'm in week 2 of my treatments, and this is happening, that's happening. We need help with this. Someone can mow my lawn for me, whatever, things like that. That has saved me so much, I can't even believe it. Okay, and it also becomes a place that you're only telling your story once, because you're gonna tell people so many. You don't even know how many times you're gonna have to describe what radiation is like, what chemo is like, all that stuff. You're already stressed. Send everybody to that Facebook page, and now you can just update it all at once. People can share things with each other, all that. That has saved me big time, just stress. So, anyway, good luck. You can make it. I've made it. Still recovering, but I wish you the best.